Hello. Hi. Okay, so I'm doing this live after so long, and it feels so good to be back. And I'm really excited for today's live because lactation has been one of the most asked questions these days, and there's so much confusion, and there are so many things involved in this that today I hope we can burst many myths about it, and we can actually help people with their lactation issues also, and help them out with all the anxiety, and there's so much emotional attachment to it. So I'm just going to pin the topic of today's live right now so that everybody knows what's the topic. And in the middle of the live, if you have any questions about lactation and breastfeeding, you can just put the question in the comments, and I'll definitely address it later on. So today's topic is lactation. One second. Chalo. Okay, let's start. So I think most of the people have joined, so we'll just start with the session. In the middle, if you have any doubt, you can just post in the comment section. So lactation, it's a process by which milk is produced and secreted, and by our specialized glands, which are called mammary glands. And the most important hormone which is secreted from a pituitary gland, which is the anterior pituitary, is prolactin. And there's a prolactin releasing hormone which is secreted by hypothalamus, which stimulates the secretion of prolactin. And prolactin helps synthesis of milk in the mammary gland, which are our breasts, and that produces milk. So this was a little scientific, but I think people who are actually interested in knowing what happens, they would want to know, and they would love to know this. Now let's talk about benefits of lactation. Now, what are the benefits of lactation? There are many benefits for the baby and as well as for the mother. So for baby, when you are lactating, initially for the first 2 to 3 days, a mother produces something called as colostrum, which is super rich in antibodies. It is rich in good fats, and it is the exact and the perfect nourishment that your baby needs. And colostrum is something that is extremely nourishing, and it helps with the immunity of the baby also. Second thing that is a benefit for the baby is it lowers the risk of asthma, it lowers the risk of obesity in your child in the later ages, it lowers the risk of even diabetes. And sudden infant death syndrome is something that that is seen more commonly in certain countries also, but breastfeeding or lactating mothers, babies are not that prone to it. I can see a question. Just one second. Ketki, please note down the questions you see in the comments, so we cover that later on.
Yes.
Huh? Yes. So all these diseases which your child can develop in the later stages, breastfeeding can definitely prevent them to a good extent. The other benefit of lactation for the babies, it aids in, it's perfect for their growth, their digestion, the right kind of weight gain that we want, the right kind of brain development at the right pace for the milestones of the baby. Breastfeeding works wonders for it, and it's the best thing that can be there for the gut of your child right now, because their digestive system is very immature and it is still developing for the first 6 months. Next is it is something that helps your baby to get into the daily circadian rhythms also. So the sleep patterns and everything starts improving when you're breastfeeding your baby nicely. Now let's talk about the benefits of breastfeeding for the mother. And I think this is one benefit that all mothers would be interested in, and that is weight loss. So when you are lactating and when you're breastfeeding your baby, you need at least 500 extra calories. So just by breastfeeding, you're burning 500 calories. And that is exactly what works wonderfully for weight loss. So even I get a lot of compliments that I've lost a lot of weight, what I've been doing. So I haven't been doing any diet as such, but I've been, nicely making sure that I'm only breastfeeding and not taking help of formula or any other top feed as much as I can. And that has helped me lose weight. And because the other thing is also healing happens really well when you're breastfeeding, because when you're breastfeeding, oxytocin is a hormone which is secreted, and oxytocin is responsible for contraction of your uterus after delivery. So by the time you deliver and when you're full term, your uterus is completely expanded, and it takes about 6 to 8 weeks for your uterus to contract, to become small and small and small and small and go back in the uterine cavity. And for that, it is very important that you're breastfeeding, because it really helps in the contraction of the uterus, so that way you recover also faster after your delivery. So postpartum recovery and postpartum healing happens really well when you're breastfeeding. Second thing is, when you're breastfeeding, initial few days can be tough. It can be challenging, but that's why I'm here, and that's why I'm there to guide you and help you through it. But once you cross those few tough weeks, it is one of the best ways in which you can bond with your baby. You can the baby bonds with you, and it's the most beautiful thing. So you start enjoying the journey later, once you cross those initial tough weeks. Then for the mother also, it reduces the risk of breast or ovarian cancers, of type 2 diabetes, of high BP issues. For lactating mothers in future, these are less common issues that they face, because it really helps them restore their health back properly. So even if it's a C-section delivery, even if it's a normal delivery, you can always opt for breastfeeding, and there are a lot of aids, lot of assistance which is there for that. Now the next commonly asked questions which I get is, what are the nutrients that a lactating mother needs, and milk supply बढ़ाने के लिए क्या खाना चाहिए, because milk supply, I think, is the most stressed out topic in mothers, and I think sometimes even if your milk supply is good, you're still obsessing ki, is my milk enough, is my baby feeding well, is he full, or is he still hungry? Because when you're breastfeeding, you can't actually measure it, and that is why you're always in doubt and always in question. So the main reason and the best answer also to that is, if your child seems to be happy, if the child seems to be satiated and sleeping well, and if your baby's weight is increasing properly, you don't have to be worried about your milk supply. But right now I'm going to tell you what are the nutrients which help in increasing the milk supply. First one is good protein. So you need good amount of protein for a good milk supply, and you can have eggs, you can have paneer, you can have chicken, you can have all the lentils and dals, and along with protein you need good complex carbohydrates. So bajra, jowar, good rice, oats, all these things will help you with the milk supply. And along with that, all these traditional foods. So there are some foods called as galactogogues which help in increasing the milk supply. So there is something called as khaskhas in Marathi. So you can have khaskhaschi amti. So like a gravy if you don't like eating sweet. A lot of people eat khaskhaschi kheer, which is more sweet, but you can put a little bit of dry fruits and all, and even that works for breast milk supply. Second thing that you can have is dinkache ladu. Just make sure that whenever you're having this kheer and ladu and everything, you can reduce the sugar content in it. That will help you with your with reducing those extra calories which you don't need. So you can have one dinkache ladu or one arifsa ladu, either of it. And one ladu a day is completely safe. It's very good for your milk supply, and all these things are galactogogues. So galactogogues help you increase the milk supply. Other thing that you can have is, you can have sauf, ajwain, that is owa, flax seeds, and little bit of sesame seeds. You can nicely roast it, add a little bit of rock salt to it, and chew on it after after your meals or in between your meals. So even that helps in increasing your milk supply. Next nutrient that is required in your diet is calcium, and the source of calciums are of course all green leafy vegetables. Almonds, even sauf is a good source of calcium. Like I said, khaskhas is a good source of calcium, and of course you can have mutton or chicken, which also helps as a good source of calcium. Then is folic acid. So folic acid rich foods are all citrus foods. Non-vegetarian. In non-vegetarian you can have chicken and mutton, and even egg yolks are rich in folic acid, and of course nuts you can have. Then iron is important. I would always suggest take a supplement for iron and folic acid, because your requirement really increases. So in your supplements also you can have an omega-3 supplement. because there's so much added demand of everything, it becomes very difficult to cover everything with food. So supplements are a no harm. So you can talk to your gynecologist, you can talk to your pediatrician, and go for the supplements for the first 6 months. After 6 months you can discontinue, because after delivery your body's demand increases. Then you're breastfeeding also, so anyway you need added nutrients to feed your baby, also the right foods. So for all these things you can use these supplements. So you can go for calcium supplement, you can go for iron and folic acid supplement, you need vitamin D supplement, you need omega-3 supplement, and you need a good protein powder if you're not eating enough of protein. If you're a vegetarian, I think you must go for a protein powder until you're breastfeeding. Now we spoke about galactogogues, and the best galactogog for the milk supply is shatavari. If you're a person like me who cannot eat shatavari kalp, which is very sweet, then you can go for tablets of shatavari from a trusted source, and those tablets with warm water works perfectly, and shatavari is wonderful for the milk supply. Now next thing that is something that I have come across is all the myths that are included in breastfeeding and in lactation. And the first myth, and which is the most common myth, is a mother should only have bland food, and if a mother eats something spicy, the baby also gets the spice. I don't think that is true. There is a lot of metabolism that happens after you eat your food. You should not eat something that doesn't go with your digestive system, and because that makes you gassy. But otherwise you should definitely eat something that you can digest well. But the spicy thing doesn't really affect the baby. Then there's another myth that babies don't require breast milk once you start solids for them. That's not true. Even when you start solids for your baby after 6 months, they always need additional feeding, and you can slowly start weaning them. And ideally you should feed your baby for at least 1 year minimum, and then you can start weaning. And if 1 year is too long for you, you can at least try to feed till 9 to 10 months. The next myth that I have seen is if a mother is sick, if a mother is not well. 1 second. Oops. Yeah, if a mother is not well, then she should not feed her baby, or if she has cold, she should not feed the baby. But that is not true. What you can do is, even if you're not well, the antibodies that you are producing when you're not well, those are also transferred to the baby. So there's nothing wrong in feeding your baby if you are not well. So these were all the myths that most of the people come across. If you have any myth or any confusion in your head whether does this work, or what else I should do, you can always put it in the comment, or you can always reach out to us also and ask these questions. I think we've covered pretty much. Yes, there's one more question which I have always gotten, that is about the formula. That can we replace giving breast milk with formula? So I would always suggest that if you feel your baby is not full, and if you still feel that your baby is constantly hungry even after feeding, and if there's any medical reason for not having enough milk supply, you can discuss this with your gynac or your pediatrician, and you can definitely start a formula. But I would always suggest you can do a mixed kind of feeding, where you are giving formula just once or twice and other feeds you're managing with breastfeeding. That kind of strategy always works better in terms of nourishing the baby. And I think all these things, when it comes together, it's just a few months of struggle. Sometimes it's hard, but once you get through it, and once you're nourishing your baby, I think it's all worth it. So let's start taking the question and answers for today's session. Yeah, so first question that I had gotten, which I read, was till when should we breastfeed? So like I said, till 1 year I think you should breastfeed. The criteria for breastfeeding by WHO is 2 years. So I think you guys can choose a middle way out of it and feed till 1 year. And a lot of people choose to wean at 6 months, but I feel that's too soon because you've just started the solids. So you can start weaning them after 8 months or 9 months also. Let's find out other questions. Yeah, there are more questions, no? Yes. Yeah, so there's one more question, that is, will exercise affect milk production? No, exercising doesn't affect milk production as long as you're hydrating yourself. So hydrating yourself is very important, because the main thing, the main component of breast milk is water. 85 to 88% of breast milk is water, and then it's other nutrients. So you need to drink a lot of water, lot of fluids, which will ensure that you have a good milk supply. Then the next question is, yes, we did discuss, you can breastfeed your baby even if you're sick. You can breastfeed your baby even if you've taken a cold shower. It's absolutely safe. And it doesn't cause any issues for the baby. In fact, the baby gets the antibodies that your body's producing for that particular issue. Yes, there's another question. I'm a C-section mother. My baby is 6 months old. For weight loss, yes, so keep your diet now. After 6 months, you can keep your diet, just keep it high in protein. You can start cutting down the carbs. So just once a day you have your bhakri or rice. Other meals in the day you can have just eggs, chicken, you can have soups, you can have salads. All these things will help. And after 6 months now, I think you can start intermittent fasting also. So you can do a 16-hour fast and then start your day. This will not affect your milk supply as long as you're hydrating well. And this will also help you with weight loss, and you can start your walks and your exercises as well. So there's another question, is feeding bottle okay to be given with breastfeed? So I think it is completely safe to bottle train your baby as soon as possible, because you also have other responsibilities to do it. Then you get a little bit of freedom of feeding the baby. But make sure you're not only bottle feeding, then it becomes very difficult for the baby to take the breast later on. So make sure that just 1 or 2 feeds are bottle feed and other feeds are breastfeed. Yes, what are the other questions? Yes, ma'am, can we give Shatavari to one 13-month-old baby with milk, as we have started, with cow's milk? Yes, you can give Shatavari, but I would always suggest that, you should not start cow's milk so early, because it is not always very easy to digest. So start with small quantity of milk, and you can start small quantity of Shatavari. There's no harm giving Shatavari to the baby. But you can still, if the baby has digestion issues, if the baby has gases issues, then avoid giving milk to the baby at a young stage. Yes, any other questions? And even if you have more questions, I will have to end the live now. It was a very nice live, and I love doing it after a very long time. And if you still have questions, you can put it in my DMs, you can message me, or you can comment on it on my reels also. And I will see you soon with next live. It will either be on my Facebook page or my YouTube page next week. So make sure you're following those pages and you join those live sessions, and I'll see you soon. Thank you so much. Bye.